everyone, welcome back for our 5th installment of Tooth Talk Tuesday. We have saved our most important topic for today. Today we are going to talk about flossing. You knew this day was coming, right? You knew we were going to have this conversation. We have to talk about flossing. I wouldn't be doing my due diligence as a pediatric dentist if we didn't talk about it. So today we're going to go over why it's important to floss, especially our kids' teeth. So the first thing I'm going to talk about is when do I start flossing? A lot of parents are asking, when do I start flossing their teeth? Do I need to start flossing their teeth? The answer is, as soon as two teeth start touching, we need to be flossing. So the age is different for every kid. Sometimes that's a 2-year-old, sometimes it's a 3-year-old. At least by 4 years old, we need to be flossing anywhere that the teeth are touching. Sometimes the top 2 front teeth touch, need to start flossing. By the time the second molars are in and those molars are touching, need to start flossing. So when I show parents in the office or tell them they need to start flossing when their kids are little, I often get a look like I'm a crazy lady. And I get it. It's not easy to floss kids' teeth. It's not even easy to brush kids' teeth, but it's so important. I do it to my own kids, so I know it can be done. And the reason it's so important is I would say 80, maybe even 90% of the cavities we fix on teeth in our office, baby teeth especially, are on these surfaces, the sides of the teeth where they touch, where even that perfect toothbrush won't reach. So things may look great clinically. We may look at the top surface and say, those things look great. But the first time we take these x-rays, we see the sides of the teeth, the in-between spots. And this is where we start to see cavities forming, right where those molars touch in the back. Those dark areas you see there are little cavities forming. And a lot of people say, well, why are you going to fix them? They're just baby teeth. They're going to fall out anyways. Well, these back baby molars don't fall out until kids are age 10 or 12. So if we're getting these cavities at age 4 or 5, we're going to try to fix them and keep these teeth healthy until they fall out naturally 5, 6, 7 years later. Now, if we were to take this same tooth and take it out of the mouth and cut it a cross section of it, this is what that same cavity looks like clinically. So we pick it up on the x-ray, but this is what it would look like if you took that tooth out of the mouth. There's, decay is starting again where another tooth would touch right here, and only the floss is going to reach this side of that tooth to get in between and clean this area so that that decay doesn't progress and progress until it's into the nerve or close to the nerve of the tooth. That's when it starts to cause pain or infection or all kinds of troubles. I don't care what kind of floss you use. You can use the old-fashioned string kind. In our office, we like to use these little kid-sized flosser sticks. They have fluoride on the string that helps it go down in between the teeth. They also have a fruity flavor versus a mint flavor, which is helpful for kids. I don't care what kind you use as long as you're doing it. I want you to start flossing early and floss often. Don't say I never told you. You'll thank me later.